Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Ratta Pitta and I have discussed relation of Yakrut Pliha, involvement in the Ratta Pitta and the version of Ratta Pitta as Mahavegam, Mahaghoram, Ashukari. So after thinking or discussing that point of Samprapti and its clinical relation in the patients, we will move towards the Chikitsa of the Ratta Pitta. Now, Ratta Stambhan is the main Chikitsa. Whatever type of Ratta Pitta it is, Urdhvaga, Adhoga or Tiryaga. And for that purpose, I have just in last lecture told you which Rasi Vibhag are useful. Among that, Madhur Ras, Pitta Kashaya Ras, Shita Virya and Ruksha Guna are useful. Now, when we are saying Madhur Rasa, Pitta Kashaya Rasa, Shita Virya is common in all these three rasas. Which rasa is more perfect or more beneficial? And let us discuss on this. Now, Madhur Rasa, Shita Virya, it is Stambhan, no doubt about it, but it is of Snigdha Guna. So, in my opinion, Madhur Rasa and its combination of Shita and Snigdha Guna are useful when there are bleeding conditions due to the conditions like ulcers, where there is internal vrana and you need to heal that vrana to stop the bleeding. In active bleeding, the more important rasa, in my opinion, is Tikta rasa. Other than Kashaya. Kashaya is also good, but Tikta and Kashaya, this combination, along with Shita and Ruksha Guna, is the best combination for the actual bleeding conditions, because Kashayaras, as we know, Akunchan, Kashayaras is of Akunchan property, so it can constrict the open blood vessels. And Tikta Rasa has got Sushma property because of Vayu Akash Mahabhut, hence that rasa can reach to the smallest blood vessels also. Hence, these two rasa, which Shita Viryas they have both have, Ruksha Guna for Shosha Ruksha is the best combination to stop the bleeding as early as possible. Everyone knows that I have not discussed anything new. The next point which is important is when your Ratta Pitta is Ashukarya Avastha, you have to stop the bleeding immediately. So you have to choose the dravya which will stop the bleeding as early as possible, and this is the important point in the selection of the dravya. As I said, Madhur Ras or Titta Kashaya Ras, Shita Virya, Ruksha Guna is a general group of guna or dravya with these properties are useful, logically correct. But the further most important thing you have to keep in mind that which dravya has a specific gamitva on the bleeding area. What I mean to say, if there is Urdhva Ratta Pitta or Saratta Stevan, you must use the dravya having same properties of Titta Kashaya Shita, but having gamitva on the Pranavasotas. I will explain. You have these four drugs with you: Vasa, Ashoka, Putraja and Lodra with you. Let us add Ushira also, Ushira or Chandan. All these dravya have same rasa vipak, Pitta Kashaya, Shita and Ruksha. So logically, by all the rasa vipak, these dravya are going to stop the bleeding. But what is the peculiarity of each drug? You will find Vasa has gamitva on Urdhva Ratta Pitta. So when in the case of Nakala Rattastrava, Ratta Stevan or bleeding through the Pranavasotas, lungs, Vasa has more affinity. Ashok has affinity towards the Garbhashay. Putraja has specific action on Pakvashay. It means sarakt mal pravritti or bleeding like ulcerative colitis, etc. Lodra has got affinity towards the Garbhashay, so it is useful in Raktabandhan as well as Pakvashay. Dravya like Chandan, Ushir, also Raktastambhan, but they have more Gamitva on Mutravah Srotas. So they are useful in Sarakta Mutra Pravritti. Hence, only principle wise this group of dravya, selection of this group of dravya is not enough. This is the first basic step. The next step will be you have to choose the dravya according to its gamitva in the body, and you should know that which bleeding is from which part and which dravya has got affinity or gamitva to that specific organ. Then only you can stop the bleeding as early as possible. See, in bleeding conditions, whatever the reason is, whatever the intensity is, stop the bleeding is your adya kartavya, and it will happen only when dravya you have chosen will reach that organ and have got high affinity to stop the bleeding from that organ. So only Pitta Kashaya Shita Ruksha or Madhu Pitta Kashaya Shita Ruksha will not be enough in this case. To stop the bleeding, you have to choose the dravya which has got gamitva on that specific bleeding organ or srotas. And this is the very important thing. If there is Saratashtivan or Urdhva Pitta, you will choose Vasa. You can add other dravya with it. You can add other dravya with it, but you can't exclude Vasa in Saratashtivan. Samely with the Kutaja in Saratta Mala Pravritti, you can add other dravya, but Kutaja will be the main component of your, should be the main component of your treatment. For Garbhashay, again, Ashok Lodha should be main component, assisted by other Raktastambhan dravya. So always remember this step that for Rakta Pitta, as a Ashukari, choose the dravya having Raktastambhan property as a gamitva on that particular srotas or organ, then only you will get the fast result. Now, Rakta Pitta, the bleeding is continuous, so these dravya should be given always muhur, continuously unless the bleeding stops. Anupan will be, in my opinion, as you will agree, Ghruta will be the best Anupan because it has got Shitavirya, Pitta Shaman property, Raktastambhan property, and hence Ashok Ghruta, Lodha Ghruta as an Anupan or Siddha Ghruta will be a better choice. Of course, if it is possible, Vasa Swaras you can use in, because it has got high intensity as a Swaras, it all upon depends on you. But in our OPD level, I hardly find Swaras we can make it or not, I am doubtful. So in that case, Vasa Churna with Ghruta Anupan or Vasa directly with Siddha Ghruta, like that Kalpana, are more useful. What we have taught until today about Ratta Pitta is about the bleeding which is we are seeing through the orifices. There is an external bleeding. But how to think about the internal bleed, we will discuss in the next lecture. Thank you very much.